Thank you so much, Annapurna, and it's wonderful to see you again.
Same here.
I'll continue to set the scene just momentarily, and then get on with introducing the esteemed panel that we have. So, going into 2020, talking about vaccines, the vast majority of countries around the world had basic functional immunization programs to protect babies and children against vaccine preventable diseases. Over the last couple of decades, we have seen a trend in more countries providing vaccines in adolescents, but most governments came into this pandemic without the infrastructure, financing, or expertise to support a life course approach to immunization. This is one of the chief reasons why the new Immunization Agenda 2030 has as its vision a world where everyone at every age fully benefits from vaccines for both health and broader well-being. And that strategy was finished before we knew what COVID-19 was. But then 2020 happened, and in every country and in every corner of the world, people began to understand the importance of life course immunization, whether they realized that was what it was called or not. Older men and women realized that they were at higher risk for more severe outcomes because their immune systems didn't protect them as well as they did when they were much younger. And restaurant employees, school teachers, healthcare workers realized that their jobs and the associated interactions that they had with people put them at greater risk for contracting infectious diseases. And adults were getting sick and dying when children were not. And this pandemic and the COVID-19 virus have made us fundamentally rethink many things. And in the immunization space, two of these things are that we need to be able to vaccinate adults with the same efficiency and effectiveness as children, and that we must consider people's lifestyle risks like jobs, travel, comorbidities, and health risks because of where they live, not just their age, when recommending vaccines for them. And there's a third lesson that I think you'll agree we're learning through this pandemic, and that is that all decisions are hard decisions with no easy answers, and we must be realistic and practical. So today, no matter who you are or where you live, you can see that vaccines play an essential role in the functioning of society. They keep schools open, they keep tourism going, healthcare systems operational to be able to address the diverse medical needs of their populations, and it makes the workforce able to work and contribute to economic growth of nations. Because when you don't have vaccines to prevent life-threatening infectious diseases, as we have all seen, society can quite literally shut down. Vaccines help to keep people well and out of the healthcare system, and that is so apparent right now. In many ways, before this pandemic, vaccines were so effective as a strategy to keep people well and society going that many people and many policymakers really took them for granted. And so with this backdrop, it's my pleasure to be with you today and with our esteemed guests to talk about the role of vaccines in building a resilient healthcare ecosystem. And what a discussion it is going to be, because we have two of the experts with us. So before I introduce them, just a little bit about myself so you'll know who's guiding this conversation. As Annapurna said, I lead our Global Vaccine Public Policy and Partnerships Group at Merck, or MSD as we're known outside of the United States. And I've been with the company for about 7 years. Prior to that, I spent my career working in Washington, D.C. with the U.S. Department of Health and Human Services, doing science and public health policy. So I feel like I really have a good understanding of what it feels like to be in the chair of a government official right now as we're all trying to address this incredible crisis. So Annapurna and I have set the stage, explaining the state of play with vaccines and the potential that they have to improve the health and the economic conditions around the world. And now we're going to spend the next 40 minutes or so digging in on the situation in India. The country has been one of the most visibly impacted by COVID and is one whose population and geographic size mean that mounting a rapid and effective response to just about any population-wide problem is challenging. Challenging, but not impossible. And as we've seen by the heroic efforts across India over the last few months. And so I want to just start by applauding all of those who have been working to respond to the pandemic and its health, social, and economic impacts in India. As a former government health official myself, I recognize just how daunting a health and humanitarian crisis of such magnitude is to respond to. And I appreciate it's not easy to think about how to do things better when you're still in the middle of a crisis, but we're asking our panelists to do just that today. So thank you to both of you for doing that and for being with us. So let me start by introducing Professor Paul, who is a pediatrician by training, has been on the faculty of the Department of Pediatrics, the All India Institute of Medical Sciences in New Delhi since 1985, and served as the head of the department for nearly a decade. He is globally recognized as a medical scientist and public health expert. The government of India appointed Dr. Paul as a member of the National Institute for Transforming India in August of 2017, where he leads the health, nutrition, and HRD verticals. Dr. Paul also served as the chairman of the Board of Governors in supersession of the Medical Council of India for 2 years from 2018 to 2020. And his tenure was recognized for a record increase in undergraduate and postgraduate medical seats, an introduction of telemedicine guidelines, district residency scheme, and a plethora of other reforms. Importantly for us here in this discussion today, Dr. Paul is part of the core team of the Union government for COVID-19 pandemic response. He chairs the Empowered Group on Medical Infrastructure and COVID Management Plan, as well as the National Expert Group on Vaccine Administration for COVID-19. Welcome, Dr. Paul, and thank you for being with us. And Dr. Randeep Guleria is professor head of the Department of Pulmonary Medicine and Sleep Disorders at the All India Institute of Medical Sciences in New Delhi, where he has been for the last 23 years. Dr. Guleria is the first Indian to get a Doctor of Medicine in Pulmonary and Critical Care Medicine. He joined the Institute in 1992 as assistant professor in the Department of Medicine, and in the subsequent years, he has been promoted to the posts of associate professor, additional professor, and professor. He has done pioneering work in respiratory medicine, and the Department of Pulmonary Medicine and Sleep Disorders has been created under his dynamic leadership since 2011 and has been ranked as the best department in pulmonary medicine in 2014, 2015, and 2016. Dr. Guleria was conferred with the prestigious Padma Shri Award in 2015 by the President of India, and recently the Dr. B.C. Roy Award in the category Eminent Medical Person for the year 2014. So welcome, Dr. Guleria, as well. And I mean, can we ask for better experts on this panel today? So Dr. Paul, let me start with you. Full disclosure, I'm a doctor of public health and trained as an evaluator. So I always like to start with problem identification and measurement, and that takes data. In India, the burden of vaccine preventable diseases is not quite so clear, as there can be a paucity of data regarding incidence and morbidity and mortality among adults. Although what we do know through some studies is that there is a heavy burden of vaccine preventable diseases in India. As a public health expert and really a visionary in this country in public health, what is your suggestion on having a mechanism to collect data on vaccine preventable diseases for adults and elderly, and how do we enhance the epidemiological research in this area?
Thank you very much, Julia. And I'm pleased to be in the company of distinguished Dr. Guleria, Ms. Aparna Das, and colleagues, and to be on this forum, which is a bridge between US and India. Grateful. Actually, you asked a very simple question. Is there a need for more data on VPDs? Of course. Indeed, we need more data because if you are expanding the coverage of vaccines in adult population as and when such vaccines are available, are affordable, are scalable, we do need data. But on the other hand, we have tremendous amount of data for childhood vaccine preventable diseases. We have a world's one of the most robust childhood vaccination program in the country, which is an amazing system running very, very efficiently, and a huge coverage well above 75% and more than 90% for some vaccines. So we have database for those illnesses. But your point that if we move forward toward vaccinating healthy adults, then healthy adults to be protected against diseases that come to them through vaccination as and when available, and we have some, truly we need to estimate those diseases and their severity and their distribution, epidemiological distribution, etc. Surely. I think to begin with, the notion of vaccinating adults is a valid public health thinking. We did not have many vaccines which work which prevent illnesses that accrue in adults, but we have some. We have for flu, for example. We created one for H1N1. It was not needed later on. So we have some choices, and indeed, a nation which A has the capacity to create vaccine, scale them up, export them, and B, because we would like to protect our population to the best possible extent with preventable diseases, this should be a public health debate, public policy debate, and going forward, this option should be very much entertained. And of course, in the context of COVID, somewhat different. This logic and this opportunity and this need has been taken to logical conclusions. So I would essentially say, going forward, if there are diseases that we can prevent through vaccines in adult population, even particularly more high-risk population by age or by any other criteria, yes, indeed, we should examine that issue through the lens of science and affordability and scalability, as well as we should be prepared for the right kind of epidemiological and other data that we need.
Thank you so much, Dr. Paul. And you've said some really important things about how you might think about this. And I'm going to ask you to touch on those as we get a little further in the discussion. But right now, I'm going to turn to Dr. Guleria and ask you a slightly different question. You're a clinician and a professor who's been engaged in training other clinicians for many years. What is your impression of the healthcare practitioner community and even medical students' understanding of the burden of vaccine preventable diseases across diverse populations in India?
Thank you, Julia. Thank you very much for inviting me. And I think this is a very, very important question because I've been sort of grappling with this for more than 25 years. And I'll start with explaining why. For many physicians, especially internists, many adult vaccine preventable diseases don't need a vaccine sometimes. That's what they think. They would argue that natural immunity has occurred. 25 years ago, when we started talking of influenza vaccination in adults, many people said that influenza doesn't happen in tropical countries and you don't need a vaccine for India. It took a lot of data, the ICMR flu network data, to show that not only do we have influenza, we have two peaks of influenza, both during the monsoon months and during the winter months. And we spent a lot of time. It was the H5N1 bird flu outbreaks which happened in parts of India in poultry and the H1N1 pandemic, which made really people sit up and realize that, yes, we do have influenza in our country. So I think there is a need to really change the mindset among clinicians. The challenge that we have, unlike the pediatric population, is that we have specialists in all areas. I'm a pulmonologist. I can convince people in my fraternity about vaccination, and I'm sure that they would be more acceptable. But you need the cardiologist also to give vaccination to their elderly with heart failure. You need the nephrologist to give vaccination to their patients with chronic kidney disease. And therefore, you have to get multidisciplinary people on board and make them understand the importance of adult vaccination. That is the challenge that we have in our country. And we are looking at not only COVID has taught us that we need vaccination, but we were talking of the influenza vaccine. We have a quadrivalent vaccine now. We were talking of pneumococcal vaccine for adults, and we, for our patients, aggressively vaccinate them or at least promote vaccination when they are admitted, because that's the time when they are more willing to get vaccinated. But the challenge that we have is in a country like India is basically looking at how do we develop a vaccine which is affordable, how do we deploy it, and how do we do a equitable allocation. Because remember, unlike the pediatric population, the adult population is much larger. And therefore, we have to look at multiple factors, getting acceptability among clinicians, getting patients to come forward and take the vaccine. And the flu shot is an annual shot. So then we have to work on getting it sort of on an annual basis rather than once in 5 years or things like that. So multiple challenges that are there for adult vaccination. But I think the pandemic has really woken everyone up that we need to develop a strategy for adult vaccination and we need to see how we can do it. I've been asking a lot of our internist, family physician friends that you could become vaccinologist, and it's a good area to develop where you could, in your outpatient clinic, start giving vaccines for influenza, pneumococcal, and other adult vaccination, and that could also be a good way of taking it forward. But I think there has to be more awareness among clinicians that unfortunately is lacking, and we really need to work aggressively into getting awareness about vaccine preventable diseases and how it can reduce the burden of disease in terms of exacerbations. Patients come to me and tell me, I took the flu shot and this time my winter months were very good. I didn't have worsening. And they come every year and ask me, has the new vaccine come and can I take the new vaccine for this winter? So I think if we are able to increase awareness, it will really help. And COVID should be one area that we can push for this, not only from COVID point of view, but for vaccination in adults.
Those are such incredibly important points, and thank you for your advocacy with your colleagues and with your patients on the importance of vaccination. Dr. Paul, I'll turn to you and ask you, do you have anything to add from your perspective on how to increase that awareness and understanding within the healthcare practitioner population?
Before we do that on scale, we must keep in mind the fact that when a vaccine has to be offered to adult population, we have to be in a position to expand it to everybody who needs it from the government's point of view. It is clearly a clinical imperative, as Dr. Guleria clearly stated. It should become part of the practice, but that's practice, an individual patient interaction based practice as of now, and it can be done even now, as Dr. Guleria has been promoting, and we are very proud of that. And I take his prescription for my dad, for example. That's one level, and that should move, and this nation can provide increasing amount of such vaccines should the need arise and should the scale up and the business models start to work. But when we are looking at vaccine or vaccines to be delivered as a part of national program, as a part of national policy, then certain things, other things kick in. Firstly, we need a large stockpile to be available on an ongoing basis. We need affordability. We need our ability to take it to scale, because nobody can be left behind. No one can be left behind. It cannot be, in that context, be left only for those who are in urban areas and are having, Dr. Guleria talked about equitable distribution. I'm echoing that and going further to say that making sure that they are connected to the vaccine delivery system, as we have done in the case of COVID-19 vaccine program. Of course, it will be a sustained campaign. Of course, it is a large population, and therefore, new ways and means of implementing such a large mission would be required. I think the bottom line is two levels. One, identify diseases that are of profound public health importance, and I think influenza perhaps would fit in if we have the right numbers and so on. Why not? Identify affordable, deliverable vaccines in a sustained manner, and then go on to start making it as a part of the national endeavor, and I think it's possible. So moving from a practice which is, or an intervention being delivered it interactively by a physician to a set of patients or individuals. This has to be then expanded to a level where there is a universal access. And that would be the step in the right direction in a manner to build the imperatives to be able to achieve that. This is the change that would be required if truly this approach has to be mainstreamed as a part and parcel of the healthcare system and healthcare paradigm of India.
So thanks so much. And that was a wonderful segue to the follow-up question that I had for you, Dr. Paul. So as you said, the pediatric immunization program in India is very well established, and it requires a kind of infrastructure that may look very different than what you need for non-pediatric immunization. And as you also said, that India has a very large population. It has a very diverse set of potentially vulnerable adults who are served by various categorical health programs, like those for diabetes or HIV. What do you think is a realistic approach, kind of getting into the nuts and bolts of this, of establishing this kind of adult immunization strategy in India? How do you do that from a systems perspective? And to your really important points, and Dr. Guleria's, how do you prioritize that from an epidemiological perspective?
So the first part is truly to be able to identify the conditions where sustained, large-scale, affordable availability of the vaccines would be possible, or it could be envisaged. That's a critical point. And there, to begin with, can be an approach to identify and prioritize people with more serious illnesses. Although, when you take it to scale, such identification, non-universal targeted identification and detection is not easy because it gets complicated. We can come back to that later. But I think the critical need for a nation of our size would really be our ability to have affordable vaccines. Vaccines that can be scaled up, can be rolled out through the program that we have. So something like a situation that prevails in childhood vaccines today, we don't have to be worried about the supply chains and the production, and we serve the world, in that space. So I think there are two elements. One is zeroing on to the population at the national level that requires vaccine. Which one gives us best dividends in terms of outcomes, health outcomes, out-of-pocket expenditure, enhancement of life, reduction in the risk of secondary and tertiary complications of an underlying disease. That's one paradigm. But the second one, which is equally important, is the ease and the access. Ease of delivery and the access to affordable vaccines. Of course, we must also remember, and that can be the third point, that if we have to move in that journey, then we as a nation must also move rapidly into manufacturing the vaccines that are potentially available in some part of the world today, and also be ready to invent vaccines that could be required on the horizon using the technological platforms that are available. So India would also like to ensure that these vaccines are made in India, these vaccines are developed in India, and I think that's the way our vaccination program will move on these three pillars. Thank you.
Thanks so much, Dr. Paul. Really important points, and I think a great set of starters for a question I'm going to ask you in just a minute. But let me turn to Dr. Guleria on this same idea. What role do you think the healthcare practitioner community can play in helping to advance this idea of more of a life course immunization against vaccine preventable diseases in India? You have a unique position as both a leading healthcare administrator as well as one of India's most preeminent experts in respiratory medicine. what advice would you give to the government and to the people of India in general on how to immunize against various vaccine preventable diseases that are of concern?
So I think, as Professor Paul mentioned, there it is multidimensional. From the first point of view, it is of course the vaccine being available. So deployment, production, affordability, maintaining the cold chain, and then prioritizing it based on the burden of disease and who would benefit the maximum has to be done. But I think two other important issues are also there. One, of course, is getting the users, that is the healthcare workers who are going to vaccinate, come forward, accept the utility of vaccination, and build it into their day-to-day practice. That also has to be built in, because unlike the how it's going on in the pediatric age group, where it's now become well accepted, we still need to develop a program for adults where the acceptability across all specialties has to occur. So it has to be done in a more robust manner so that we have all stakeholders on board. And we also have to look at the market forces so that the vaccine availability is there, not only from the production point of view, but also from the point of view of that it is locally made. The reason why I'm trying to say that all of this has to come together is that many years ago I had talked to some industry people and said, why don't you make an influenza vaccine in India? And the answer that they gave to me was that the market isn't there in India. We won't be able to sell enough doses in India if we were able to produce a large amount, because the acceptability of adult vaccination among the doctors and physicians was not that much. So we need to get that acceptability there, work along with them, and also get the market forces aligned along with the production and the cold chain maintenance. Unless we do that, the program will have challenges. But I think the most important factor is prioritizing and affordability, because that will be very useful if you want to have a vaccine program for adults which is sustainable and is able to really have the life cycle course of immunization.
Yeah, thanks, Dr. Guleria, for those really important points. And I think, between you and Dr. Paul, you've really described kind of the chicken and egg problem. We talked about having data so people understand that there is a problem, and then how do you get people to acknowledge that there's a challenge, to want to do something about that challenge in order for a solution to come forward. And I think that's why these kinds of conversations are so critical. So I'm going to go back to my history working in a government planning office and really try to dig in a little bit on how you would actually make this happen here in India. Dr. Paul, who do you think needs to come together to make a start at this kind of conversation? For example, do you see the National Institute for Transforming India playing a role in consulting on this? And who would the experts be that you think would come together to deliberate on revising the immunization strategy to be able to address some of the things that you've raised today? What do you think INTAGI or other groups could do to play a role in this?
I think you have correctly identified the issue as a chicken and egg problem, but it can be solved. It is not an insolvable chicken and egg problem. I go back to the vaccination scale-up story of H. influenzae B or rotavirus. Same story. The need was there, potential need was there. It was not part of the national program. It wasn't even getting imported for others. Rotavirus vaccine, the same story. Then it was becoming quite evident that the vaccines are effective and we have a disease. And gradually, an atmosphere was created that such a vaccine would be needed. That's an advocacy effort backed by science and evidence and the potential of saving lives and potential of saving Delhi's. And in step with opportunities to create and to adapt the vaccines that were available. For H. influenzae, if I'm right, it's largely the existing vaccine that was started to be manufactured here. For rotavirus, we actually invented the vaccine. And it happened. And over a period of, I think within about 4 to 5 years of the vaccine being made available, it's now part of the universal vaccine program. So every child, every infant, every newborn of 6, 10, 14 weeks is now entitled to receive rotavirus vaccine. It's a now nationwide program after a phase of 5 states and a few more states. But the vaccine came into picture only in 2014, final product. So it can happen in tandem. There are ways of doing it. And our science enterprise, coupled with academia, champions, and coupled with industry, it can happen in step with each other. So I think today we don't have to go, to wait for, one thing to end and the next one to happen, sort of a situation. That was a slightly different paradigm for some of the previous vaccines. But in more recent times, both things can happen in step with each other, provided, as you correctly started with, have data, we offer, scientific evidence as to what we will achieve by way of better health and saving and better life. And in the meanwhile, work toward making such capacities available within the country. The way our nation would operate would be that we would like to see these capacities for vaccine in India. And you have seen that even in the context of COVID-19, where the time windows were relatively short, the nation rose to the occasion. And we have a plethora of vaccines available on the stockpile, the pipeline of production and R&D, which we are very proud of. So we have multiple platforms, DNA platform, mRNA platform, you have protein subunit, you have an inactivated virus, and then other virus, other vaccines, including the nasal vaccine on the horizon. So multiple platforms are available. They came up rather quickly, and each one of them is promising in terms of the volume that we can create. So the short answer is yes, it is chicken and egg, but I think you can tackle them in a sensible way together, provided there is a decision, there is a movement, there are champions, there is science, there is rationale, and there is a clear vision that we have to achieve, but at an affordable cost.
Thank you so much, Dr. Paul. I think you've laid out really well what that parallel set of activities are that needs to come together into roadmap for getting this done, and recognizing that it's going to be an incremental process, but you need to get all of the right stakeholders around the table and moving in that direction. So, I think you've really touched on what needs to happen from a policy and a systems perspective. And I'm going to go back to Dr. Guleria for your perspective on the criticality of making sure that those policies and systems actually come to life through the healthcare system. And that, and as you've said before, if people don't see the value in them and they don't realize and recognize what their promise is, then that promise is not realized. And so in that vein, I'd like to get your perspectives on two things with regard to healthcare professionals. One, which you've already touched on, is the healthcare professional as a patient. And I know you know the data better than I about the vulnerability of healthcare workers to infectious diseases like influenza due to their jobs, and the very significant incidence of influenza and related diseases in the healthcare practitioner community in India. And at the same time, there is that very, very low vaccination coverage rate. So what is your recommendation on getting healthcare workers to understand the benefits of vaccination? And then kind of going to the healthcare professional as an educator and a vaccinator. And I think you've made some great comments about this already. How do you get the attention of those healthcare workers, once the systems and policies are in place, to ensure better adherence to clinical guidelines and to get them to talk to their patients about and to recommend vaccines? And I think they're probably linked to each other a bit, but would love to hear your perspective on both of those challenges with the healthcare practitioner community.
Thank you. I personally feel that as far as healthcare workers are concerned, it is something that we need to work in increasing awareness among them, but also to some extent nudging them and pushing them to get themselves vaccinated, because it's not only for them, but it's also for the patients that vaccination is important. We would not want a person to have influenza and spread it in our ICU or in a transplant unit. And that's why it's very important to have healthcare workers understand the importance of getting themselves vaccinated. I've had this challenge. I've been working aggressively to get my residents to get themselves vaccinated. Many of them were reluctant, saying that, I think I've already got flu in the past and therefore I may not need the vaccine. I have natural immunity. I used to send all of them to the our employees health scheme OPD to get themselves vaccinated. Many of them were not going, and I then flipped it, and we got the vaccine in our ward into the OPD and gave it right there and made sure all our residents got the vaccine. And you have to lead by example, so you go and get yourself vaccinated, and then get all your residents and other faculty also come forward to get themselves vaccinated. So it has to be a sort of a movement among the healthcare workers, and they have to realize the importance of getting themselves vaccinated, not only to protect themselves, their family members, but also their patients. Secondly, when the second part is actually, there can be two parts in that. One is, of course, increasing awareness among physicians and making them understand how you can decrease the burden of disease, or how you can decrease mortality by vaccinating people who are at high risk of getting severe infection. There is data which is available, but it has to be collated and shown to them, especially which is more, let's say, from our own country rather than from the Western world. And at the same time, it's also another thing that I've realized is sometimes it's important to educate patients also. If the patients ask the doctors that, should I take this vaccine? I've heard it's useful. Then sometimes that also is helps or changes the doctor's mind, and he says, yes, you can go ahead and take the vaccine. So along with the program that we start, we will have to start an awareness campaign both for healthcare workers, for doctors, and probably for patients by using various groups. If we are able to do that, then I think the two things would work together, and we will be able to have a large number of people willing to come forward to get themselves vaccinated, doctors prescribing the vaccine, and the supply chain being available for an affordable vaccine which is made in India and therefore is easier to give to the large population that we would need to give it to.
Thanks so much, Dr. Guleria. And I love this idea of leading by example and creating a model. And I have to say that, both you and Dr. Paul are just incredible champions and models for that kind of change in India and around the world. So really appreciate all of your efforts. And maybe just with the minute and a half we have left, I will ask you both to spend maybe 30 seconds on what is the one thing that you would like for us to take away from this conversation about the role of vaccination in improving health systems and bettering well-being and health in India. Dr. Paul, maybe I'll go to you first.
I would like to understand better which adult vaccines and vaccination programs can give us great dividends going forward, and at what cost.
Excellent. And Dr. Guleria.
So I would echo that. I would say that we need to have a database from our own country, also looking at the cost effectiveness of the vaccine to show that it really helps in saving lives and is making a difference. If we can do that, I think we would be able to convince more and more people to come forward, both in terms of policymakers and in terms of healthcare workers, to get themselves vaccinated.
Thank you so much. So well said. Thank you for your thoughtfulness and taking the time to provide your expertise with us. And I also just wanted to thank, in wrapping up, the US-India Strategic Partnership Forum for creating a space for this incredibly important discussion to take place.